Presiding officer, on Monday the SNP published yet another NHS recovery plan. That's 5 plans in just 4 years. Now, I know Biffa are suing the government, but this isn't the kind of recycling Scots are looking for. A pledge for a digital front door promised in 2021, not delivered. Fast-track cancer diagnostic centres in every health board promised in 2021, not delivered. And the height of the SNP's ambition is that patients will only wait a year for treatment. Do the SNP really think that's success? It's little surprise then that Colin Pullman, the director of RCN Scotland, said nursing staff reading this will be left scratching their heads, wondering just how the aspirations in this plan will be achieved in reality. Is it not the case that this SNP government is now just desperately scrambling around because they know, as everybody else in Scotland does, that they've broken Scotland's NHS? First Minister.
No, I don't agree with that. I accept there are challenges in the National Health Service. I'm very candid about that. And I set out in my speech at the Robotarium in January exactly how the Scottish Government is going about doing that. Now, let me give Jackie Baillie some reassurance about the progress that we're making. In April 2024, the Scottish Government provided additional funding to NHS boards to deliver 64,000 additional procedures by March of 2025. By the end of January, 75,500 additional procedures had been delivered. We promised 64,000 over a whole year. Within 10 months, we delivered 75,500. In addition to that, in all 4 key radiology diagnostic tests have shown a decrease, with a 4% decrease in the total waiting list size for diagnostic tests. So I accept there are challenges, but the Scottish Government is focused on delivering progress for the people of Scotland, and that's what we're delivering now.
Jackie Baillie. Presiding officer, the First Minister talks as if this is year zero. It isn't, because after 18 years in charge of our NHS, there's no one else left to blame. Let's take the crisis in primary care as an example. Back in 2018, the SNP unveiled a big new plan with the usual fanfare. They promised to deliver 800 more GPs. The result? Today there are fewer whole-time equivalent GPs, while demand has soared. In fact, since 2013, the number of whole-time equivalent GPs has fallen by more than 200, while funding has been cut by the SNP time and time again. It's the SNP's constant cycle of failure. Create a problem, announce a plan, things get worse, so rinse and repeat. Dr Ian Morrison, chair of BMA Scotland GP Committee, told the BBC that general practice is at crisis point. Is he wrong? First Minister.
I accept that, as I've said throughout all of my answers about the health service since I became First Minister, there are challenges, because what Jackie Baillie ignores is the impact on population health as a consequence of our global pandemic that's had a colossal impact, not just on the health service here in Scotland, but across the United Kingdom and in every affected country in the world. So I recognise the challenges in the NHS. And on the question of GPs, we have seen an increase in the number of GPs in total headcount by 307 since 2017, and we already have in Scotland 82 GPs per 100,000 of population in Scotland, compared to 64 in England, 67 in Wales and 75 in Northern Ireland. So we've invested in general practice to make sure general practice is strong to meet the needs of the current period. We've also invested in broadening the staff base within general practice, and also by the recruitment through health boards to make sure that allied health professionals are able to contribute to meeting the demand as a result of the COVID pandemic that is now presenting itself in the National Health Service. So let me assure Jackie Baillie that the Government is absolutely focused on delivering improvements in the National Health Service. We're beginning to see the fruits of that plan that's resulting in more procedures, more activity, more engagement in the National Health Service, and there'll be more of that to come in the period ahead, because the Government's put a record sum of money in to support the National Health Service.
Jackie Baillie. Presiding officer, once we see again the SNP spin machine wanting to pretend that everything is fine. But John Swinney cannot escape his record, because after a global pandemic, he was the one who cut hundreds of millions of pounds from Scotland's GPs, from social care and from mental health budgets. And what's the result? Cancer targets missed, waiting lists out of control, deadly diagnosis delayed, thousands forced to go private. But don't worry, the 5th NHS recovery plan in 4 years will definitely sort it all out. And when it doesn't, there is still time to fit in a few more before the election. NHS nurses, doctors and ambulance workers are not fooled. 800,000 Scots stuck in pain on an NHS waiting list are not fooled. They deserve more than the SNP's hollow apologies and half-baked plans that never get delivered. Isn't it the case that after 18 years in charge, if the SNP had a plan to fix the NHS, they would have done it by now?
First Minister.
Well, that is just what we hear from Jackie Baillie every single week, and it ignores the facts of what are actually going on. So it's important. Well, Jackie Baillie's raised some really important issues about cancer care, and I want to
hear one another.
And I want to reassure members of the public, because it's not good enough for Jackie Baillie to create the alarm that she is creating with those questions. Yeah. So let's take the 31-day standard. 94.7% of patients, 94.7%, were treated within 31 days of a decision to treat, and the median wait is 4 days. Now that is demonstration of the achievements of the National Health Service. And most importantly, we are treating more patients with cancer on time within both the 31 and the 62-day standard than compared to the same quarter 5 years ago. 4.5% more within the 31-day, 1.6% more than the 62-day standard. Jackie Baillie mentioned mental health services, child and adult mental health services. For the first time, we are now meeting the 18-week standard, which is an important commitment to support the mental health of children and young people in our society. So yes, there are challenges, but this government is absolutely focused on delivering on the National Health Service. That's why we put the record funding in place, and that's why Jackie Baillie couldn't find it within herself to back the government's budget. She's not interested in investing in the National Health Service. It's just politics, politics, politics for Jackie Baillie.